Good afternoon. Once again, this is Dr. Larry Kidd here at Henry Mayo Newhall Hospital, and I am joined today by Elizabeth Tarantini, who is a licensed clinical social worker here at our hospital, and she's also a supervisor of the social work staff here at the hospital. And as previously we've discussed, it takes a number of individuals to take care of patients in a hospital. And here at Henry Mayo, we have an interdisciplinary on our team, myself being one of the administrators for the hospital and chief clinical officer. And then we have a number of other individuals who are supporting our employees and our patients in a number of ways. And social work is one of those valuable team members. So Elizabeth will be answering questions that you've submitted related to her area of expertise. One of the first items to review today, wearing of masks. We've had a number of questions since our last Facebook Live regarding who should wear masks, what type of mask. And hot off the press this afternoon, the CDC has adjusted their position on the use of using masks in public. And what that recent development is they are recommending that individuals, when in public areas, that they wear a cloth type material covering their nose and their mouth. And that could be a handmade mask as an example. And on the CDC website, you'll see more details regarding that. Keeping in mind that is recommended when you are in public, such as being in a grocery store. The wearing of such material to cover your nose and mouth is for the purpose primarily of protecting other people. Because the whole COVID-19 virus is not always known because you don't always have symptoms, individuals could be carriers of the virus, transmit it to others and not know that. So that mask is basically helping to protect others that might become infected. To protect yourself, the best way still is good hand washing, frequent hand washing. After touching any surfaces, good hand washing, not touching your face, in that you could still contract the virus through mucous membranes such as your eyes and so forth. And then the other primary is social distancing. Staying at home still is recommended and the best way to minimize your risk to contracting the virus. So that is our latest update related to the use of masks in public generally. The first question for Elizabeth this afternoon. One of the viewers is asking, what is the best way to take care of yourself during this time?
Well, I think one of the biggest issues that we have currently is, as far as social distancing is concerned, is that people are staying home, but we're human beings and we're hardwired for connection. We want to be connected with each other, and isolation breeds depression and anxiety. So we have to really try to maintain our connection with people, whether it's by phone, by FaceTime, finding ways in the upcoming holidays to connect with families, to reach out to your spiritual and religious communities that have online services and things like that for support, and also checking on elderly. We have a lot of family who are very high risk, so making sure that we're making those connections and taking the time to be with, connect with family, with grandparents, parents, things like that.
Okay, very good. As Elizabeth indicates, other mechanisms to stay in touch with individuals, loved ones, without physically being present is still very important to maintain that contact.
Exactly. It helps you and it helps them. So it really helps maintain that connection and helps us through those times of anxiety and uncertainty that we all have right now.
Right. We had a question come in about testing. Here at the hospital, we're starting to see test results come in much faster. At one point, we were up to about a week in getting the results back, and now we're seeing test results come back in as short as about 48 hours. So we've seen a great improvement there. The question had to do with where is the best place to go for testing. And there are a number of test sites, but again, as we previously indicated, there's a screening that takes place. So not every individual is a candidate to be tested. There is the criteria for individuals to be tested, and there's an assessment that is done, and that determines who would receive a test. The first line of where you might go for testing has to do with whether or not you have a primary health care provider, or if you might receive your health care services at a clinic. You would contact that location and they would determine what would be the appropriate place for you to go. Having said that, if you do have acute concerns, you have an urgent need to be seen, we do have the ability to test at our emergency room, but again, it's based on a screening that you would receive initially, and then the appropriate course of action would be taken, which might be moving forward with the test. Elizabeth, there's a question about folks concerned about should they be watching the news and keeping up with social media during this time. Is that helpful, do you think?
I think it really depends. I think we have to monitor what our anxiety level is and how overwhelmed we're feeling. So kind of self-monitor. I would say certainly reach out on social media for situations like this where you're getting informed information, but make sure that your source is reputable. Typically we say look at CDC websites, look at .edu or a .gov, a .gov. When you're looking at research or data is usually a lot more helpful and accurate. So those are things that might be helpful. And when you are even just watching the news, just try to limit it if you feel your anxiety is reaching out of control or starting to heighten a little bit. So just self-monitor and make sure you're using it sparingly.
Right. Very, very good advice. We had a question come in as to whether it was okay to have surgery. Is that appropriate during this time? Currently, the recommendation from the experts is if there is not an immediate need to have an elective surgery, that you would delay that surgery. Of course, you would always want to consult with your primary physician around the appropriateness of having that surgery sooner than later. You would certainly not want to prolong a surgery that might have a worse outcome if you defer to do that later. But your surgeon, primary healthcare provider, would be able to assist you in determining what would be the best timing for you to have that surgery. I do want to point out that should that be needed at our hospital, we're certainly staffed, have the equipment, and we're capable of performing all required surgeries at this time, should that be indicated. Next question for Elizabeth has to do with what an individual can do to provide a sense of normalcy for their children. They're with their kids at home all day, and they're kind of thinking about, normally they'd be in school, there'd be a whole nother routine, and now they're basically at home. How could they have some sense of a normalcy in day to day?
Kids thrive on consistency, so I think it's really important to establish a routine, especially during the week, trying to make things fun as well. The local schools have lots of good tips as far as maintaining the school activities and things like that at home. And on the weekends, making it fun, making sure there's some downtime, some playtime. Play is important at every age and every stage, so making sure that we are still enjoying and playing and laughing with our children is super important. Also, when it comes to kids, they know something is different, so have them look for the helpers, what we say, the nurses, the doctors, that they're trying to help and answer their questions as they come up, because their anxiety is definitely heightened as well, and they're concerned. And our community has had a lot for children of all ages over this last year. So They're feeling a lot more insecure and a lot more unsure, so just at their own age level, helping them developmentally where they are, answering their questions where they are, and looking to additional supports as needed as well.
Okay. The question was asked, adjunct to that is how to speak to kids about what's happening with what's different in the world right now. What about this virus?
I think, like I said, just keeping it really on their level, as much as they can. Maybe don't go, you may have an idea as to what it is that they're asking you, but they may be asking you a very simple question. So keeping it so it's not too frightening, but you are informing them, talking to them about things like compassion and community, and creating that sense of community that I might not be sick, but I may be wearing a mask for other people who may be immunosuppressed or have other health concerns. So we do it for our community, not just for us. And I think that's important to foster now, a sense of responsibility for all of us within our families, to each other. It's an important value that we can teach our kids right now.
Right. We always have the question of what is the status of our supplies at the hospital. Currently, we're still managing in terms of supplies, the ventilators that people often ask about. We have that equipment on hand. We will be posting later this evening on the Henry Mayo Hospital Facebook page a request for donated masks. So for example, staff who are not working in clinical areas, who don't require a N95 or any kind of special hospital type mask, we're going to be helping support our staff to have masks that they could wear in public areas, that sort of thing, that they would be able to take home with them. So that information will be posted on our Facebook page, and certainly the information on how to donate will be listed there. And then we're close to the end of our session again today. We'll just ask Elizabeth if there are any last recommendations or suggestions she'd like to share with our viewers today.
Just take care of each other. I have a resource that we'll be posting on our website on coping with stress during this time. It's got a lot of good hints to help you look at, to inform your families and to take care of yourselves. And Henry Mayo is always a resource for our community, so please let us know if there's anything we can do to help you.
Okay, very good. We'd like to thank Elizabeth, our licensed clinical social worker, for joining us today. Very, very good tips for our viewers today. We thank you for joining in out there once again, and we hope today's session has been beneficial to you. We look forward to being with you again next week, and we hope you have a safe weekend out there. Thank you very much.